Benzodiazepines. I'd like to ask a few questions and then we will get the answers after we have discussed the topic. Name the two most common disorders that require the use of benzodiazepines. Which ion goes inside the cell when benzodiazepine attaches to the GABA receptor? What is a typical short acting half life? What should you do with the dose of digoxin when there is a benzodiazepine also being prescribed? What makes the overdose of benzodiazepine worse? What is the treatment for overdose? What's a good non benzodiazepine for dementia or brain injury patients? Which medications can help with tapering? Can benzodiazepines be given in pregnancy? When are benzodiazepines used? They're used in panic, insomnia, phobia, anxiety, alcohol withdrawal, status epilepticus, mania, and Parkinson's. How do benzodiazepines work? Benzodiazepines bind to gamma subunit of the GABA receptor. This increases the chloride influx as the cell becomes negatively charged and potassium leaves the cell. This process hyperpolarizes the neuron's membrane potential and leads to decreased neuronal firing. The inhibitory effect of GABA is increased, which results in sedative and anxiolytic effects. Let's review their drug interactions. Benzodiazepines are mostly metabolized by oxidation by the enzyme cytochrome P450. Cytochrome P450 inhibition increases plasma concentration, action, and toxicity of benzodiazepines. Drugs that inhibit cytochrome P450 are the mnemonic I code. I for isoniazid, C for cimetidine, O for oral contraceptive, D for disulfiram, E for estrogen. These medications cause enzyme inhibition of diazepam, chlordiazepoxide, chlorazepate, and flurazepam. Next up is nefazodone and fluvoxamine. They cause enzyme inhibition of triazolam and alprazolam. Phenytoin and digoxin. Benzodiazepines cause enzyme inhibition of these two medications. Therefore, there is a risk for toxicity. Kava plant potentiates benzodiazepine action. Narcotics and alcohol increase sedative effects of benzodiazepines. Clozapine, when combined with benzodiazepines, may cause delirium. Another mnemonic is LOT, L for lorazepam, T for temazepam, and O for oxazepam. These three are not dependent on hepatic enzymes for metabolism. Antacids reduce benzodiazepines' GI absorption. Smoking and food causes enzyme induction. Pharmacologically, after half hour to 1 hour of ingestion, benzodiazepines start being absorbed. Their lipid solubility determines distribution, onset, termination of action. It is not the half life that determines all of that. They're deposited in adipose tissue, and you may want to consider a differential diagnosis of thyroid dysfunction, caffeineism, and prescription medication. Recommended to start slowly and taper. The short acting benzodiazepine half life is 2 to 4 hours, long acting, 2 to 4 days, and intermediate acting is 1 to 2 days roughly. Short acting benzodiazepine with a half life of 2 to 4 hours. Withdrawal is common, and short half life causes rebound insomnia and anterograde amnesia. The non benzodiazepine anxiolytic drugs, known as Z drugs, act on alpha 1 subunit of the GABA A receptor and cause selective sedative effect. They lack muscle relaxation and anticonvulsant effects, and they're not to be used more than 7 to 10 consecutive days. They have little tolerance or rebound effects. The names of the Z drugs are ezopiclone, zolpidem, zoliplam. The other short-acting benzodiazepines are quazepam, triazolam, midazolam. Of note is another non-benzodiazepine called Buspar. Buspar combines with 5-HT1A agonist receptors and is a partial agonist of selective serotonin reuptake inhibitors. Its onset may take up to 2 weeks, and it is not for acute anxiety. It has active metabolites, it is non-sedating, causes no CNS depression, and no muscle relaxation. It has no additive effect combined with alcohol, causes no dependence, no tolerance. It is good for agitation in demented and brain injury patients. Short half life medications are not given in chronic anxiety. Long acting medication, their first pass hepatic metabolism increases their duration of action. So, what is first pass hepatic metabolism? It is during the metabolism of the benzodiazepines, liver produces active metabolites. Those are absorbed into the circulation and produce benzodiazepine actions once again. Long acting benzodiazepines' half life can roughly be 2 to 4 days and longer for hepatic failure patients. Their steady plasma levels can take up to 2 weeks. Therefore, signs and symptoms of toxicity may appear within 7 to 10 days. To remember the names of the long acting benzodiazepines, I have a story I want to share that may help you recall their names. So the story goes something like this: Tim wants to clone himself, so he goes to his closet and drinks chlorine. He gets flu like symptoms and dies. To review that, Tim for temazepam wants to clone for clonazepam himself. So he goes to his closet for clozapate and drinks chlorine for chlordiazepoxide and gets flu-like symptoms for flurazepam and dies for diazepam. For intermediate acting benzodiazepine, their half life can be 1 to 2 days approximately, and the mnemonic here is ALO, A. Alprazolam, L. Lorazepam, O. Oxazepam, E. Estazolam. Intermediate acting medications can sometimes go in the short acting and sometimes in the long acting category, specifically which benzodiazepines are used for which disorder. For panic disorder, alprazolam, lorazepam, clonazepam, diazepam. As you can see, they go from intermediate to long acting. For insomnia, triazolam, temazepam, flurazepam. The Z drugs, zolpidem, zolpidem, and estazolam. For phobia, clonazepam, diazepam. For anxiety, same as panic. For alcohol withdrawal, Ativan, chlordiazepoxide. For status epilepticus, Valium IV and clonazepam. For mania, same as panic and anxiety, that's alprazolam, lorazepam, and clonazepam. Of note, clonazepam has been shown to increase the time between cycles and decrease depression episodes. Parkinson's sometimes is zolpidem for tremors. Now let's discuss the withdrawal and its management. The withdrawal may begin the day after discontinuation and continue for weeks or months. It depends on the drugs, which leads me to my next question. Withdrawal peaks rapidly and intensely for which type of benzodiazepines? That would be short half-life benzodiazepines. What rebound effects occur when benzodiazepines are abruptly discontinued? That is anxiety and insomnia. Signs of withdrawal are going to be neurologically, insomnia, perceptual disturbances, hyperpyrexia, seizures that are rare, delirium, and pins and needle sensations. Cardiovascular wise, tachycardia, increased blood pressure. Psychiatrically, anxiety, panic attacks, impairment of memory and concentration, derealization, hallucinations, and depression. Musculoskeletally, muscle cramps and spasms, as well as pain. Also, respiratory could be flu like symptoms. For the side effects of benzodiazepines, imagine everything going down. We have sedation and drowsiness, confusion, ataxia, and anterograde amnesia, such as when midazolam is given before surgery. In terms of mood, Paradoxical anger and behavioral disinhibition has been observed with short-acting medication such as triazolam. Respiratory depression and physical dependence may also occur. Adverse effects are going to be seizures in those who may already be prone. Overdose and its treatment. Benzodiazepines are safe in overdose when taken alone. However, they're dangerous with alcohol as it has synergistic effect at the chloride ion site, causing membrane hyperpolarization. The drug of choice for benzodiazepine overdose is flumazenil IV. If the mixed drug overdose involves opioids, naloxone should be given prior to flumazenil. Fatal outcomes are likely when benzodiazepines are combined with tricyclic antidepressants, barbiturates, or alcohol. Flumazenil IV. Half-life is 7 to 15 minutes. Adverse effects are seizures, and IV management can be given as listed below. If there is still no response after taking flumazenil, then probably the overdose is not related to benzodiazepine. How do you taper a benzodiazepine? You start with 10% tapering every week when taking for more than 2 to 3 months. For instance, alprazolam 4 milligrams a day is being given. Taper it by 0.5 milligram per week for 8 weeks. What two drugs can be given to help with tapering? Carbamazepine and beta blockers. Which drug do you switch to if you're having trouble with alprazolam taper? Switch to clonazepam, then gradually taper clonazepam. For benzodiazepine contraindication, it is the increased risk of sedation or confusion with hepatic dysfunction patients. If necessary, you can give the lot mnemonic drugs, lorazepam, oxazepam, temazepam. There's an increased risk in elderly due to the decreased liver function. It is best to avoid during pregnancy. Specifically in first trimester, they cause cleft palate. Other contraindications include myasthenia gravis, chronic respiratory insufficiency, and angle closure glaucoma. Name the two most common disorders that require the use of benzodiazepines. Anxiety, insomnia. Which ion goes inside the cell when benzodiazepine attaches to the GABA receptor? Chloride ion. What should you do with the dose of digoxin when there is a benzodiazepine also being prescribed? Monitor for signs of toxicity due to enzyme inhibition. What makes the overdose of benzodiazepine worse? Alcohol, TCA, or barbiturates? What is a typical short-acting half-life? 2 to 4 hours, roughly. What is the treatment for overdose? Flumazenil IV. What's a good non-benzodiazepine for dementia or brain injury patients? Buspar. Which medications can help with tapering? Carbamazepine and beta blockers. Can benzodiazepines be given in pregnancy? No. Causes cleft palate.